Are ultra-processed foods, UPFs, harmful to weight loss and overall health? The answer is not so simple. Every day, it seems, we are bombarded with new studies or news articles highlighting the negative aspects of ultra-processed foods, UPFs. Many of these reports paint a grim picture, urging individuals to either significantly reduce their intake of these foods or eliminate them altogether. However, recent research indicates that the reality may be more complex than it appears. Numerous experts caution that UPFs are linked to a greater risk of various health issues and may even play a role in premature mortality. Yet, the term healthiness, which is often left undefined in many studies, does not always provide a clear answer. Some research, along with a recent statement from the American Heart Association, AHA, suggests that while it is wise to limit UPFs high in fat, sugar, and salt, there are also certain UPFs that can be nutritious, budget-friendly, and fit into a balanced diet. This evolving perspective suggests that not all UPFs are created equal, and their impact on weight gain and health may depend more on their nutritional content rather than merely their level of processing. Nicola Guess, PhD, a registered dietitian at the University of Oxford, expressed her concerns in a recent essay, stating that the category of UPFs is so broad that it becomes nearly meaningless. She pointed out that it groups together items like store-bought whole grain bread and hummus alongside cookies, potato chips, and soda, which are vastly different in terms of health benefits. Are UPFs the main cause of obesity? There is a consensus among researchers that diets high in UPFs are linked to increased calorie consumption and weight gain. However, some experts challenge the notion that all UPFs are responsible for weight gain. In a recent article published in Nature Reviews Endocrinology, Philippa Jewell from SUNY Downstate Health Sciences University and her colleagues noted that both epidemiological and experimental studies consistently associate UPF-heavy diets with higher energy intake and weight gain. They suggest that the adverse effects of UPFs may stem from their unique nutritional, physical, and chemical properties, which could affect various biological processes, including how we experience food rewards, regulate appetite, and maintain a healthy gut microbiome. To combat the global obesity epidemic, the researchers advocate for comprehensive policy measures aimed at reducing UPF consumption and fostering healthier food systems. A 2024 review of evidence concluded that increased consumption of UPFs is a significant factor driving obesity rates. The lead author, Samuel Ticken, PhD, from the Center for Obesity Research at University College London, conducted a randomized controlled trial comparing a UPF diet with a minimally processed food (NPF) diet over 8 weeks. Participants were provided with nutritionally balanced meals according to UK dietary guidelines. The results showed that the NPF diet led to a more significant weight loss of 2% on average, compared to just 1% for the UPF diet. Additionally, participants reported better control over their cravings while on the NPF diet, which likely contributed to their reduced calorie intake. Ticken noted that while a 2% weight loss might not seem substantial over 8 weeks, if these results were projected over a year, it could translate to a 13% weight reduction for men and a 9% reduction for women on the NPF diet, compared to only 4% and 5%, respectively, for those on the UPF diet. Over time, these differences could become quite significant. However, some experts critiqued the study, pointing out that both groups lost weight, which raises questions about the assumption that all UPFs lead to weight gain. Gunter Kuhnle, a professor of nutrition and food science, remarked that the findings suggest a diet adhering to current dietary guidelines does not negatively impact weight maintenance, regardless of whether it consists of UPFs or not. Moreover, the crossover design of the trial, where participants switched diets with a washout period in between, may have introduced an order effect, resulting in less weight loss during the second diet phase for both groups. Kevin McConway, PhD, an emeritus professor of applied statistics, also expressed skepticism regarding the researchers' methods for predicting long-term weight loss based on the trial's short duration. Are all UPFs unhealthy? If the impact of UPFs on weight loss varies based on the quality of the foods, could the same principle apply to their health effects? Researchers frequently utilize the NOVA classification system, which categorizes foods into 4 groups based on their level of processing, to assess the health implications of UPFs. NOVA warns that the manufacturing processes and ingredients used in UPFs often lead to nutritional imbalances, making them prone to overconsumption and replacing less processed foods. In contrast, dietary guidelines tend to focus more on nutritional content, caloric intake, and limiting added sugars, saturated fats, and salt, rather than the degree of processing. This means that some foods may be deemed healthy according to government standards, but not by NOVA, and vice versa. A recent extensive study involving over 200,000 adults in the U.S. found that participants who consumed the highest amounts of UPFs, as defined by NOVA, had an 11% greater likelihood of developing cardiovascular disease, CVD, and a 16% higher risk of coronary heart disease, CHD, compared to those who consumed the least. When combined with data from 19 other studies, the findings indicated that high UPF consumption was associated with a 17% increased risk of CVD, a 23% higher risk of CHD, and a 9% greater likelihood of having a stroke. However, the study also revealed a more nuanced picture. The authors noted that specific types of UPFs had different associations with health risks. For instance, sugar-sweetened beverages, processed meats, and artificially sweetened drinks were linked to higher risks of CVD and CHD. In contrast, ultra-processed savory snacks, cold cereals, and yogurt-based desserts were found to be inversely associated with these risks. Interestingly, certain UPFs, like ultra-processed bread and cold cereals, were linked to a lower risk of stroke, while hard liquors were associated with a reduced risk of CHD. Similarly, a large-scale analysis from the Nurses' Health study indicated that overall UPF consumption correlates with a higher risk of type 2 diabetes, T2D. Yet among specific UPF categories, items like cereals, dark and whole grain breads, packaged snacks, fruit-based products, and yogurt were associated with a lower risk of T2D. Additionally, a proof-of-concept study developed a sample menu that derived over 80% of its calories from UPFs, as defined by NOVA, while still adhering to the 2020 Dietary Guidelines for Americans. Remarkably, this menu achieved a score of 86 out of 100 on the Healthy Eating Index, despite being primarily composed of UPFs. The authors noted that the menu fell short of a perfect score mainly due to excessive sodium and insufficient whole grains, but it still provided adequate amounts of most macro and micronutrients, with the exception of vitamin D, vitamin E, and choline. A narrative review raised an essential question: what exactly makes UPFs detrimental? Is it their nutrient composition or the processing they undergo? The authors concluded that we still lack definitive answers. The AHA's scientific advisory and many recent studies call for further investigation into the health effects of food additives and processing methods, as well as research to clarify the impact of UPFs with better nutritional profiles. In her recent essay, Guess argued that the focus on UPFs distracts from what we already understand about nutrition. She emphasized that we consume excessive amounts of fast food, sugary drinks, and snacks like cakes and chips, while failing to eat enough legumes, fruits, and vegetables. She advocates for improved food and nutrition policies that facilitate healthier dietary choices for everyone. Dickin disclosed that his research was funded by the National Institute for Health and Care Research, NIHR, and other organizations, and he has received royalties and consultancy fees related to his work on UPFs. Marilyn Larkin, MA, is an accomplished medical writer and editor whose articles have appeared in various esteemed publications, including Medscape Medical News, The Lancet, and Reuters Health.